Hi everyone, how are you? I hope you all are doing well. I am doing fine. I got my little Odie here loving up on me today. I am really sorry that I haven't put out a video in a long time, and I'm here to tell you why. About 3 weeks ago to a month ago, I got really sick, and I started getting really sick. And I didn't know what it was, and it kind of seemed like it was a cold, but I had a really bad cough and I wasn't sleeping, and it was kind of a big deal. Anyway, so about a week and a half ago, I actually went into the hospital, and I've been literally in the hospital ever since. I got released today. That's part of the reason why he's being so clingy right now. I haven't seen them in a week and a half. Love and attention. Yeah, hi. So what happened was I got diagnosed with bronchitis and pneumonia in both lungs. So that was what was attributed to the fact that I couldn't seem to breathe or get air. I was coughing really bad and couldn't sleep. But on top of it, I was only able to breathe in about like 25% of what I normally would be able to. And the doctor there wasn't very comfortable with that. He goes, I don't understand. He said, normally I get it, people, they can take deep breaths and it makes them cough, but it just seems like you just stop at a certain point and can't go any further. Honey. I know. I missed you too. Anyway, so he decided, that he wanted to go ahead and do a CAT scan to be able to figure out why, just to make sure that there was nothing going on and there wasn't anything more serious. So anyway, he did a CAT scan, and what he found was multiple pulmonary emboli in both the upper and lower part of my right lung. For those of you who don't know what that means, pulmonary emboli are blood clots within the lung. It's very serious. It can be fatal in many cases, in most cases, to be honest. In fact, when they said that I had them, it was very emotional for me because I had, this bracelet right here, as many of you may know from me talking about it in the past, is a symbol for my friend Sophie, who died from a pulmonary embolism right after our senior high school graduation. And so it was when they said that I had multiple pulmonary emboli in the upper and lower right lung, it was very emotional for me because that hits close to home. I know someone who passed away from that, and it's not, they're not a joke, and it's very serious and stressful. Things that are too stressful and stuff on your body can force them to move, and they can travel to your heart, and they can kill you, and things of that nature. They can stop blood flow to your lungs. They're very serious, and to find out that I have multiple is a big deal. It was also something that was extremely unexplainable to doctors because I'm 23 years old and I'm not, like the most highly active of people, but I am active. Prior to me getting sick, I was actually training for a 5K, so I was running. Then all of a sudden it got to like I couldn't even walk up. I live in a split level home, so like a normal flight of stairs is split in half because you come up the first level and then you're here on the landing and then you go up the second level, but total that's one flight of stairs. I could make it up that first level and I had to stop on the landing to be able to take a break because I was out of breath. It didn't make any sense. But I'm stubborn and didn't go to the doctor when I probably should have. But honestly, had I not, my breathing wouldn't have been as bad because the pneumonia and the bronchitis wouldn't have gotten as bad, and they might not have ever checked because pneumonia patients, you just give them some medication and send them home. And so that's what would have happened. And they might not have ever checked, and we might not have ever found the pulmonary emboli, and it could have gotten worse and even fatal. And that's really scary for me to think about. Anyway, so for the past week, I've been in the hospital trying to recover and taking breathing treatments and staying on bed rest. I wasn't really allowed to do very much, but I'm back home now. And I'm out of the hospital, and I'm taking lots of medication. Well, I shouldn't say lots of medications, but I'm on blood thinners and I'm on antibiotics. And just trying to, kind of get back into the swing of things, but taking it slow because they don't just go away. You don't just take some blood thinners and then they're just gone. You take blood thinners so they don't get any bigger, but it's your body's job to get rid of them itself. Your body produces chemicals in its own medication that over time breaks down blood clots, but it takes several weeks. And so I constantly have to keep in the back of my mind that I have to remember that they're still there, and I can't push myself too hard because they're still there and they could break loose, and I'm taking blood thinners and all that kind of stuff, but so that they don't get any bigger, but that doesn't mean that they're not gone, that doesn't mean that they're not there, that doesn't mean that they're gone. I try to remember that. I still obviously, as you can hear, have a cough because I still have pneumonia. It doesn't just go away either. Even though I've been in the hospital and taking breathing treatments 4 times a day for, half hour to 45 minutes while I was there, it didn't, I was really bad, and I had it in both lungs, and it didn't just go away, and so I'm on antibiotics. But the weird thing that doesn't make any sense to people is that, like, I have liver problems, and, it's like a genetic thing that I just ended up with. Well, the weird thing about it is liver problems create a slower clotting time, and yet I'm getting blood clots, which means my clotting time is faster, which doesn't make any physical possible sense because those two things don't go together. They just don't happen together. And it was very frustrating for the doctor because they're like, you have liver problems and yet you're clotting faster than you're supposed to, and those two things don't happen. And I know that. So it is very strange. And so now I have to go see a hematologist and start, which is a blood doctor. They're hoping maybe that I have like some sort of coagulation deficiency and that I can take a medication and, essentially it'll fix it and repair it. But I don't know. I really don't know what's next. I feel like I seem very calm, but mostly every time I think about it, I think I'm just kind of in shock of it all because, this doesn't happen to someone who's my age, and I'm healthy. I'm not, I have a couple pounds on me, but I'm not overweight by any means. I'm not obese by any means. I eat pretty healthy. I'm active. I don't take birth control. I don't smoke. I don't do drugs. I don't do anything. And I used to be on that kind of stuff, not smoking or drugs, but I used to be like on birth control and other medications. But when these liver problems started to happen like 2 years ago, I got taken off of literally absolutely everything that I was ever on. So I haven't been on that stuff for 2 years. So everything that is any type of indication or predecessor to blood clots, I don't have. So literally, it makes no sense. There's no explanation, and that's what's so frustrating and also a bit scary for me because we have no idea why this is happening, which means there is no reason that it can't happen again. I'm only on these blood thinners for so long. And it's just long enough, essentially, for them to be able to keep my blood thin enough for the clots to go away. And then just a little bit of, like, time after that, just to make sure that everything's okay, and then I get taken off of them. The thing is, though, that for me, the scary part is knowing that we don't know why this happened. We don't know where they came from. And what's really scary for me is that since we don't know why it happened, where they came from, what's going on, there is no real indication to know if and when it will happen again. And that's kind of scary, because once I'm not on the blood thinners anymore, it's like, what if it does happen again? And we don't know because we didn't know this time. There were no signs. There were no symptoms. There was nothing. I was not in pain. I was not having trouble breathing prior to the pneumonia. That was the only reason I was having trouble breathing. I was still running. I was still active. It didn't make any sense. And yet they were there and they were forming. And it's like, what's to say it won't happen again? And that the next time I won't know until it's too late. I wanted to share with you guys why it is that I haven't been around, because I told you that these videos are kind of like a video diary for myself, and it's just like a look into my life and a way for me to kind of look back on things later on in life and to kind of see things that I went through. But it's also a way for me to introduce you guys into my life, and I don't it's all about me being honest. I'm not trying to hide things, and this is what's going on in my life right now, and it's very scary. And I'm doing the best that I can to just kind of get back to life as normal, because that's all I know how to do right now. that's all I have. And I will see you guys soon, hopefully next week. If you have any questions, about anything that's going on, feel free to ask in the comments. Do whatever. It's fine. Like I said, I'm not trying to hide anything. So it is a difficult topic and all that kind of stuff. And I don't know a whole lot right now. But what I do know, I'm willing to share. And when I know more, I'll be willing to share. So, just if you have any questions, feel free to ask. Bye.